Welcome back to Wound Technology with Frank. In the next so many series, we're going to discuss different modalities that can increase oxygen to that chronic hypoxic wound bed, specifically hyperbaric oxygen therapy and topical oxygen therapy. Both I'm very familiar with. But first up, hyperbaric oxygen, we're going to talk about a patient that is entering a pressurized chamber breathing 100% oxygen. That oxygen gets dissolved in the bloodstream and is delivered systematically. Usually, it helps with promote healing and fight infection, and your deeper, complex diabetic foot wounds and radiation injuries usually benefit from this, and there's other indications we'll discuss in the next series. The typical pressure is usually about 2 to 2.5 atmosphere absolute, and to make a little distinction, on Earth at sea level, we're at 1 atmosphere absolute. Now, the other device is topical oxygen therapy. This is localized and is using different devices to increase oxygen to the hypoxic wound bed, delivered straight to the wound site. It's non-invasive. It can be used at home and in the clinic. There's 2 types though. There's one intermittent, where oxygen is supplied at a high pressure in a cycle, mimicking the pulsating of blood flow to improve perfusion. One of these devices is TWO2 by AOTI. I'm very familiar, there's a lot of research behind this product, and it's using a concentrator, a high flow concentrator, to deliver 10 liters per minute. 100% oxygen for 90 minutes per day can be done at home, but also it uses humidification and non-contact cyclical compression. Yes, that's right, it can develop compression at up to 50 millibars. That translates to about 37.5 millimeters of mercury. This is different than circular compression, but it helps with swelling. Now, the other product is continuous diffusion oxygen. This delivers low flow oxygen around the clock and can be used continuous using a small wearable device. One of the products is Natrox, delivering low flow oxygen about 13 milliliters per hour with a battery operated device, and oxygen is generated through a tube to a disposable oxygen delivery pack. The other product, check it out, is also EO2 Concept, and this is also continuous. Is topical oxygen delivered under cyclical pressure using a seal dressing system. Now, the delivery is about 10 to 15 milliliters per minute. And so, bottom line, hyperbaric oxygen therapy treats the whole body. Topical oxygen therapy treats the wound bed, hypoxic wound bed. They're both beneficial for patients. It's not one versus the other. It's when to use at the right time for the right patient. Stay tuned as we're going to go into these devices in more detail.